Hello and welcome to another episode of Ask the Doctor. Today we will discuss breast cancer with Dr. Pamela Strickland, a breast surgeon with Northiside Hospital, Cherokee. Breast cancer is a complex disease affecting millions of women and even some men worldwide. In this edition of Ask the Doctor, Dr. Strickland will shed some light on the important aspects of breast cancer, from the different types to risk factors as well as possible prevention and treatment options. Welcome in, Dr. Strickland.
Hi, I'm Dr. Pamela Strickland, and I am a breast surgeon with Cherokee Breast Care here at Northside Cherokee Hospital.
What types of breast cancer exist?
Well, there are multiple different kinds of breast cancer, and in order to understand it, we need to take a look at the different kinds of tissue that make up a woman's breast. A woman's breast contains glandular tissue, which is the part that's responsible for making milk when you breastfeed. There is also fibrous connective tissue that's sort of the scaffolding that holds all of it together, and then fatty tissue, which is the part that gives the breast its cushion, if you will. Breast cancer usually starts either from the glandular tissue, either the lobular or the ductal. Lobular tissue is the part that makes the milk, and the ductal tissue is the part that carries the milk out through the nipple. So the two main subtypes of breast cancer would be lobular cancer versus ductal cancer.
Is it true that women with minimal risk factors can develop breast cancer?
Yes, this is true. I have a lot of women that come in and feel like they don't have a risk for breast cancer because they don't have a family history. But if you looked at all the women in our country diagnosed with breast cancer in a given year, 50% of them had no identifiable risk factor other than their sex and their age.
Can men develop breast cancer?
Men can develop breast cancer. I think breast cancer is usually thought of as being a woman's disease, but that's not the case at all. Men can develop cancer. Men, their breasts are made up of the same types of tissue as women's, but there's just a proportionately less of the glandular tissue in a man's breast, and that's the part where breast cancer usually starts. So they have a lower risk. Male breast cancer only accounts for about 1% of all breast cancers. In men, genetic predisposition and family history is an even more important factor than it is in women's breast cancer. So if a man has a strong family history of breast cancer, he needs to be more aware of what's going on with his breasts. And a woman who has a male family member who had breast cancer, that's the kind of information she needs to share with her physician.
Can breast cancer be prevented?
Yes and no. If you look at the different risk factors for breast cancer, including sex, age, family history, there's also body weight, alcohol consumption, smoking cigarettes. Most of these factors, especially the first few I mentioned, are not factors that we have any control over. However, the things that we do have control over would be avoiding smoking or tobacco exposure, or any nicotine exposure for that matter. Avoiding alcohol consumption. This is one that we've known for a while, but it's only more recently started getting publicized more. There's no proven safe level of alcohol. That's not to say if you enjoy a cocktail from time to time that it's going to be the reason that you would develop breast cancer, but it's best to limit that and only consume it in moderation. Having regular physical activity, I generally recommend about 150 minutes a week of moderate intensity exercise. It doesn't have to be all at one time. You could do 10 minutes in the morning, 20 minutes in the afternoon for 5 days a week. You can break it up however you like. It's just a matter of being more physically active. Maintaining a healthy body weight. We know that weight gain after menopause is associated with a higher risk of breast cancer. And then finally, eating a healthy diet, a well-balanced diet that is rich in fresh fruits and vegetables and whole grains, minimizing red meats especially, as well as processed foods and refined sugars. If you look at all of these factors, about 30% of breast cancers could be avoided by paying attention to these last 5 factors I mentioned.
What are the stages of breast cancer?
The stage of breast cancer has to do with how big the tumor is, whether or not it has spread to the lymph nodes, and whether or not it has spread to other parts of the body. Stage 1 would be a small tumor, less than 2 centimeters, that is confined to the breast. It has not spread to the lymph nodes or anywhere else in the body. Stage 2 would be something that's a little bigger, between 2 and 5 centimeters, or in a couple lymph nodes under the arm. Stage 3 would be bigger than 5 centimeters or in a lot of lymph nodes. And stage 4 means that it spreads somewhere else in the body besides the breast and lymph nodes. Stage 1 and 2 are considered early stage, and that means there's a better prognosis, that the 5-year survival for stage 1 and 2 breast cancer is between 90 and 99%. For stage 3 breast cancer is considered locally advanced but still potentially curable, and the 5-year survival for that is 70%. Stage 4 breast cancer is considered metastatic breast cancer, and in those cases, it means we're not necessarily treating it with a cure in mind. We're treating it to keep you active and feeling good and getting the most out of the life that you have left. So stage 4, these days, because of better treatments, the survival for stage 4 at 5 years is 25%. So it doesn't mean that it's a death sentence, and it doesn't mean that we can't treat it and do meaningful things to help slow it down and prevent further progression.
What questions should patients ask that are not often asked?
Well, there are a number of questions. I think one would be to ask whether or not tumor profiling would be indicated. So in some cancers that meet certain criteria, we can do tumor profiling tests. And what this does is it looks at those minute genetic changes within the cancer itself. So this is not talking about hereditary breast cancer or risk for hereditary breast cancer. This is talking about what happened in that breast tissue cell that made it become a cancerous cell. So each cancer has its own individual genetic signature, if you will. And by testing that, it gives us an idea of, number one, is this a cancer that's at a high risk of coming back somewhere else later? In other words, it might start off as a stage 1, but if it comes back somewhere else in your body, it would be stage 4. And it also can give us an idea about whether or not chemotherapy would be beneficial for that cancer. So it gives an idea about what treatment options would be best for that particular cancer. Another question that I think most women should ask is whether or not they need to have genetic testing. Now, this is different than tumor profiling. Genetic testing is looking for a hereditary genetic mutation that could be handed down from generation to generation in the family and puts a person at high risk for developing breast cancer. So it's not something that we offer to just the general public. But in patients who are diagnosed with breast cancer, if they meet certain criteria, then genetic testing can be advised. I have a lot of patients that ask, do I need to have my other breast removed? They have the idea that if they have cancer in one breast, it's just a matter of time before it spreads to the other side. And they feel like if they do this big surgery of a double mastectomy or removal of both breasts, that it's going to mean they never have to deal with breast cancer again. And that's not the case. Even when we do a double mastectomy, there is still a risk that the cancer could come back in the chest wall, lymph node area, or elsewhere in the body. So even doing the bigger surgery does not guarantee that you won't ever deal with it again. Most breast cancer patients, in the absence of a known genetic mutation, really don't have that high of a risk of developing cancer in the opposite breast. It's about a 1% incidence a year. So, most women don't benefit from doing the bigger surgery in terms of their survival. Now, there can be other reasons to consider it. If you've seen abnormalities or had other biopsies in the opposite breast, if you are going to have a reconstruction and you're concerned about better balance and symmetry with the reconstruction, So there are other reasons to consider it, but it's not something that I routinely recommend for all breast cancer patients. Another question that I think is especially important for younger women is, will I be able to have children after my treatment? Increasingly, we're seeing younger and younger women being diagnosed with breast cancer. And when a woman in her late 20s, her 30s, or even early 40s may not have the family that she wants yet, she may not be finished with childbearing. Some of the treatments that we use for breast cancer can affect a woman's fertility. There are methods available to help a woman preserve her fertility for childbearing after the cancer diagnosis has been taken care of, but those usually require early intervention, so ask the question early. And then finally, I think it's important for a patient to ask, what will my life look like after breast cancer treatment? Will there be any permanent limitations in my activities or my range of motion with my arm? Will I still be able to play tennis? Will I still be able to bowl every weekend? The things that affect one's quality of life after a cancer diagnosis and treatment. So I think it's also important because asking that question helps a woman focus on what's ahead, on the future, on the long goal.
What is one piece of advice you wish everyone would follow?
Get your mammograms. I think that's the most important one. I have a lot of people who say they are afraid to get a mammogram, whether because they're worried that it's going to show something, or potentially if they have implants, they're worried it's going to damage the implants. A lot of different reasons. Concern about radiation exposure. But realistically, the mammogram is the best tool we have available for screening for breast cancer. And there are other modalities like ultrasound or breast MRI or thermography and those types of things, but none of those is intended as a replacement for a mammogram. They're intended to be used in conjunction with mammography. The most important aspect of cancer care for breast cancer is early detection. We want to catch the breast cancer before it produces symptoms, causes a lump you can feel. So mammogram is the best way to accomplish that. I think another barrier that some women see as an issue with regards to getting a mammogram, especially if they feel a lump or some other change, is if they don't have insurance. And I think it's super important for people to know that there are programs out there that can help pay for part of the cost of doing a mammogram in those patients. So if you feel like there's something going on with your breast and you think you might need a mammogram, even if you don't have insurance coverage, you should call a breast center and ask them what programs are available to help with that. Thank you so much for listening in this morning to Ask the Doctor. I'm very pleased to have been able to present this information to you. If you or anyone you know is having some type of problem with their breast that they need to have evaluated, you can certainly call at the office, 770-721-9320, Cherokee Breast Care. And I'm Dr. Pamela Strickland.
Thank you for tuning in to this episode of Northside Hospital's Ask the Doctor. We hope you found our discussion on breast cancer informative. Remember, understanding the different types of breast cancer, recognizing risk factors, and knowing the importance of early detection can make a significant difference. If you have any questions or need further information, don't hesitate to reach out to Dr. Strickland at Cherokee Breast Care. Stay informed, stay healthy, and we'll see you next time on Ask the Doctor.